So I'm Stephanie, your statewide food shelf liaison. Welcome to Monday, everyone. So today our meeting is just really focused on trying to find some out-of-the-box ways to get foods to our clients. I know that's the most pressing issue right now, is just that there's a supply shortage and more clients than we're able to handle. So I just really wanted to introduce you to some people that are doing some unique things with their food programs, and then also just give you some other ideas as to where maybe you can source some food. So we'll have a few presentations today, and then at the end, we will put you in breakout rooms with whichever presenter you'd like to ask more questions to. And then you can get those questions answered. I think Colleen was going to say a few things about the White House listening session if she's on.
I am on.
There. Good morning, afternoon.
Hi, everybody. I don't know if you've heard things about this White House one-day conference that's coming up this week, but I was really lucky because I was chosen to attend in person. And so I'll be joining the meeting in person in DC. This is the first time in 50 years that we've had this opportunity to have a White House conference to really focus in on health and nutrition and hunger. And so I'm really honored, and I want to be able to represent all of you well. So if you have particular things you think that I should focus on, you can put them in the chat and I'll read them then and take that information with me to the White House. So after Joe and I have time to debrief, then, no, I'm just kidding. So when I come back, I'd be glad to share some information with you about everything that was happening. So thanks a lot.
All right, so we're going to hear from Jessica Francis of Open Cupboard now, kind of about her food program and how that's working for her.
Great, thank you, Stephanie. Do you have my PowerPoint, or should I put it up?
Yes, we do have that. 1 second here. There we go.
All right, great. Great. Well, hello, everybody. I'm happy to talk for a little bit about our today's harvest markets. So we opened our first today's harvest market last year, and it is a little bit different than a food shelf. We at Open Cupboard operate a drive-up traditional food shelf, have more traditional food shelf mobile programs. But today's harvest is a different kind of model. And it's a free fresh market that provides fresh produce, milk, meat, dairy items, everything that we rescue every day from local grocery stores and get from local farms, other things. So our markets are open 6 days a week, and they're just high access, low barrier models. You maybe move to the next slide. Okay. So this is a photo from our first market that we opened in May of 2021. For those who are in the metro area, it's located in north side of Oakdale, right off of 694 and Century Avenue. And so this isn't a small strip mall. It's under 2,000 square feet of space. And then on the right, you can see a photo of our space. So it's basically a large produce table that sets up to look like a store, and then 3 coolers and a freezer and space for bakery and dry goods. So it's a small model focused on the top 5 items that are requested at food shelves. And then the next slide, you can see our second market that we opened in March of 2022, just maybe about 6 months ago. So this model we actually opened up at our existing site. So this is located, for those in the metro, it's located more in the southern corner of Oakdale. So this is one where people are able to visit and go to our market 6 days a week. But then on Thursdays and Fridays, we also have our drive-up services, and people are able to get both services in the same day. And so at this new site, we were able to get a little bit more space. So we're able to offer some additional choices. We have 2 checkout stations, and so we're able to serve.
Oops, you went on mute, Jessica.
Thanks. Yep, my whole screen just went black, so now it's back. At these sites, so a person will walk in, grab a small shopping cart. You know, it's smaller than the regular grocery store shopping carts, and then go through our line and pick out usually a bag of fresh produce. Sometimes we have more fresh produce, so they can pick out more than just a bag and pick out whatever they choose. And then the numbers of items that people can choose will really depend on how much food we got in that day from the grocery stores. But usually they can pick up another 8 to 10 other items other than the fresh produce. And so those are, you know, milk, a meat item from the freezer, and then selections of other dairy and deli items, and then bakery. So maybe in the next slide, I'll talk a little bit more about the experience. The retail format, what we have really gotten feedback from others is that the retail format related to this really reduces the stigma. We have bright signage and branding. We use all of our displays are usually have been donated from local grocery stores. So it feels more like a grocery store. And just by eliminating the intake product or process. So people walk through the door and they're handed a shopping cart, or they walk through the door and grab a shopping cart, just like you do at a grocery store. There's no barriers that they need to cross before they can get to the food. And that's really a difference. What we've found from folks is that changes the way they feel about the experience, because they don't have to you know, answer any questions or give any personal information before they're able to start shopping. And then also just by offering consistent shopping hours, just the fact that we can say we're open from noon to 6 Monday through Friday, and we're open from 10 to 1 on Saturdays. We have the same hours at both of our markets to make it simple and easy for people to understand and to remember, and it just more closely imitates the grocery store experience. So if you can go to the next slide. And just the low barrier model, we have found really increases the access. We do not distribute TFAP in our markets, so we are not required to collect addresses or names or any personal information. So it just really reduces that stigma, because people don't have to give that information. And then for some people that are concerned about providing the information, some because of stigma and other people because they're concerned about their immigration status or other things, they respond to the model because it doesn't require that. Our being open 6 days a week and the consistent schedule really just helps make it more accessible for folks, and that they can just know that they can come by and get food when they need it. and they don't have to be planning as much about, like, have I already had my visit this month, or have I already had my visit this week? People can come to the markets as often as they like. They could come daily if they wanted to. What we have found is that about 75% of people come once a week. And then there's a proportion of other people, like 16% might come twice in a week. And then there's a small proportion of people that come three or more times in a week. And those people on average take less food because they're coming in more regularly, maybe just picking up a few additional items. So it really just changes the conversation with people because they don't have to perceive this as their visit. And they can instead come and get the fresh items that they need, and that they can feel reassured in knowing that when they need more fresh food, they can just come back. I think the next slide, please. Thank you. So the impact of the model, when we first started at our first today's harvest market, we were estimating that we would serve about 80 to 100 shoppers a day. And so that we chose a small strip mall based on that assumption. We were quickly serving well over that, actually within our first week. And so within a few months, we were serving more than 200 shoppers a day. So we've just really found that very quickly that this model was working for people in a different way than our traditional food shelf was, and that there were more people that were interested in coming and willing to come to this type of market. So in our first year at our first market, we had more than 53,000 shoppers. We collect phone numbers from people if they choose to share it, because that's a way that they can simplify their next visit by just typing in their phone number again. And then they don't have to answer the questions about how many adults, children, and seniors are in their household. So for the 3/4 of people that are willing to share their phone numbers, and we're able to see how often they come. So we've gotten unique households, more than 7,000 unique households that have shared their phone numbers when they have visited. And we've distributed more than 800,000 pounds of food. Our records show that every month we're serving on average 535 first-time shoppers. So people are just continuing to tell their friends and family about the market. We stopped promoting pretty early on because we were hitting our max capacity, but people were telling people about it, via word of mouth. So it's just continued to grow. We did a survey with Second Harvest last summer and found that 50% of those that were responding to the survey said that they had not previously been using a traditional food shelf or other food program before they visited us. With the huge numbers that we were serving in our small location, we saw that we were able to meet the need in a different way through our Today's Harvest markets. So we opened our second market in March of this year. And just within our first 3 months, we had 21,000 shoppers from 5,200 different households. We've served more than 160 zip codes across Minnesota and Western Wisconsin. And we distributed more than 350,000 pounds of food in our first 3 months. So what all of those numbers just tells us is that there are a lot of people that are interested in this model and are just responding to it in a different way than they were responding to our traditional food shelf. The way that the food is provided just reduces those barriers and allows us to serve more people. And I know I'll pause to answer any questions if people have, but also that we have a toolkit that we've created thanks to funding from Hunger Solutions. And so Stephanie has that toolkit. So that really lays out a lot of the details about like how much food did it take, how many volunteers does it take, a lot of those kinds of questions about the model.
And that will be posted on our website as well.
Perfect. So there's a question, where did we get the funds to do this? So we got the funds from a lot of different places. The idea really sprung from all of the wonderful donations we got in 2020. We were able to take a look at the donations. Our board really felt strongly that they didn't want all of the funds to just sit in our bank account. We wanted to do something more and do something different. And so, within 100 days of us looking at the model, we had opened our first market. So we were able to use some of our own existing funding as well as get some new funding.
So at the end of this meeting, we'll have breakout rooms where you can go, where you'll be able to select which presenter's room you want to go in and ask questions. So you'll be able to ask Jessica or the other presenters all the questions at the end of the meeting.
Yeah, that sounds great. So then I won't be answering these questions now.
Yeah, we'll just wait until the end. Make
All
sure
right,
that
sounds good.
we have time for everyone to present.
Yeah, got it. Thank you.
Yeah, did you, oh, one other thing. So Jessica's shelf was the first one that I visited in this role, and something that was also kind of stood out was just that they had beepers at the door. So people didn't have to wait in line. They could come and grab a beeper and then they would be paged basically when it was their appointment time, which just kind of added to the dignity of the shopping experience, I thought. So that was another cool thing that they do. And so then next we'll hear from Ann Hill with Twin Cities Food Justice.
Great. I don't have any fancy slides, but I will just take a few minutes to tell you what we do. TC Food Justice really operates with 4 core values. The first is improving health by providing good, fresh produce, especially among those who are food insecure, to address the economic and health inequity that exists, to make sure we're environmentally sustainable, and to engage the whole Twin Cities community in the issues of food waste, food insecurity, and hunger. So what we do is we are a go-between. We simply pick up food, almost exclusively fresh produce and bread, not really the long-term shelf stable items, but produce and bread, and we deliver it to a number of different organizations: food shelves, food pantries, places like Community Kitchen, which makes meals for people who don't have homes, Provision. A lot of different organizations receive our food. We pick up from the small organizations that like co-ops, food co-ops like Seward and East Side and Mississippi Market. We pick up from those locations, and our goal is to have the pickup and the delivery of the food within an hour. So our volunteers, we've got about 70 volunteers, and they pick up either a regular shift or they sub in on shifts to pick up that produce and deliver it almost immediately. Last year we rescued about 250,000 pounds of food. And we are on track to do that again this year. We make sure that the pickup and the delivery of the food by our volunteers is very close in proximity so that we keep our carbon footprint small. Some of our volunteers pick up on their bikes. We have bike trailers that they can use to keep the environmental impact at a minimum. We have a couple of different programs. One is simply to pick up the food, rescue the food and deliver it to food shelves and food pantries. We also have a program we call the Full Fridge Initiative, and we purchase a refrigerator if they need it for maybe a subsidized housing, maybe an organization that is providing housing for people coming out of incarceration, coming off of addiction that are providing services. We keep that refrigerator fully stocked with fresh produce every day. That really takes away the stigma and the obstacles to eating fresh, healthy food because they just go to the kitchen and pick what they want whenever they want it. And we keep those refrigerators full stocked. We work closely with, if you're familiar with Aon Properties, that they manage a number of subsidized housing facilities, 3 in fact in downtown Minneapolis, but others around the Twin Cities area. We also do something we call the Priceless Produce Program, where we go into let's say a low-income housing facility, and we have a pop-up grocery store. So we go in on a Saturday morning and we have tons of fresh produce, and whoever would like to help themselves can. And it's really a community event within those facilities. One thing that is really taking off is this year is we're providing more food within healthcare programs. So a great example is the University of Minnesota has a free clinic in the Phillips neighborhood on Monday and Thursday nights. We have a table there where we provide fresh produce. Students that are in the nutrition program man that table and tell people about the importance of eating healthy. They provide recipes. They explain things like, what do I do with kale so it doesn't taste so awful? So it's a really good partnership, and we're able to provide quite a bit of food to the patients that attend those clinics. And that's it. We work with Phillips neighborhood. We work with the People's Community Clinic down by Augsburg, North Star Clinic. We work with a number, and what we found that does is it gets people into the clinic and also educates and provides them with good, healthy food. So right now, what we're doing is we have lots of donors. We're always looking for more food donors, but more importantly, we're looking for more food recipients so that we can expand the number of organizations that receive, good, healthy produce. And again, we pick up from a number of different, including the Minneapolis Farmers Market down on Lindale. Pick up 800,000 pounds of fresh produce. So we're always looking for new partners to receive that food. And it's at no cost to the food donor or the food recipient. We just give that food out and hopefully that it gets to the people who need it. I think that's all I have. I could say that we were started about 6 years ago, by 5 graduate students at the University of Minnesota who were in the public health department. All 5 of them are still involved in the organization, and really saw the discrepancy between the amount of food waste and the amount of food insecurity, and formed this organization to be a link between those two to address both.
Thank you. And I'll just say as well, for people that might be outside of the metro area, I'm definitely working on a resource guide for all of Minnesota, and all of these resources will be in there. But I definitely know that the rural shelves are seeing an increase, especially with the movement of low income housing and affordable housing going out to those areas. So we know that you all are seeing a lot of need out there too. And we are working on resources closer to your area. Our next speaker, I believe that they do some shipping. I'm not sure how far they ship, but Yia can come on and tell us about that.
Hello, how's everyone doing? My name is Yia Yang. I work at Open Arms in Minnesota. Thank you for having me be part of this wonderful Zoom presentation. This is, like I said, my first time in this space, so I'm happy to hear all the resources that have been being offered. For those that don't know, Open Arms is a nonprofit organization that prepares and delivers nourishing meals free of charge to critically ill Minnesotans and their loved ones, caretakers. Our registered dietitians and in-house chefs prepare these meals, and then our volunteers deliver them free of charge to our clients' home. So let me see if I can see if I can't see if my
Your slide?
yeah, is it on
Flyer?
the screen?
Not yet. 1 second.
Okay.
Here. There we go.
Okay, so this right here is a flyer that I have going on right now for a project that I'm leading. I'm the culturally specific meal project manager here at Open Arms. So I'll talk about this first before I dive into kind of our general programming. So right now we're looking for recipes from folks that have lived experiences in the Hmong, East African, and Latinx community. And so we are looking to diversify our menu to better reflect the diversity of our growing client base. So this is a project that we're happy to, like I said, roll out there for folks to participate in. If you submit a recipe and if we can complete it, we'll pay you $200. And if you take your phone, you can scan that QR code right there. It'll take you to the link to the website with more information. And from there, you can see what the criteria are and why we need these recipes. So, you know, it's a great opportunity for you to submit recipes yourselves or tell your clients, tell your friends, family. You know, we've had this for a couple months now, and you know, we've gotten a very good amount of recipes. You know, we haven't looked at them extensively to see which ones we can make yet. So some, like I said, may be more challenging than others, depending on supply chain issues and just what's available in terms of produce and meats and stuff and whatnot. So this is a project that we have going on right now that I would be delighted if you all could participate in or share. And if you want an electronic version of this flyer, I can send you one. I have this in Hmong, Spanish, Somali, and English. So I'd be happy to send this out to you so you can share with your network, your clients, your customers, for them to participate. So like I said, that's the main goal of our project right now, is to get recipes. But Open Arms in general, like I said, we make meals for folks that are ill, and so we medically tailor these meals to control, and you know, for fat and all that stuff that our nutritionists take care of to make sure that folks get these meals, because you know, food is medicine. You know, that's at the heart of what we do. And you know, Open Arms, you know, I've been here since March. It's been a wonderful experience. You know, we're here in South Minneapolis at 2500 Bloomington Avenue, but we're also opening a St. Paul location very soon, probably January 2023. You know, it's been delayed a little bit just because of, you know, supply chain issues again. So, you know, Open Arms started in 1986. Our founder, Bill Rowe, was just cooking food in his apartment and delivering to a handful of neighbors that were living with AIDS. And so, you know, that's at the heart of what we do. It started during the AIDS, during the 1980s, during the AIDS epidemic. And so, you know, we've obviously expanded since then. And as far as numbers wise, you know, I know this past couple of months ago, we reached our 10 million meal. So there was a feature in Star Tribune about, you know, us delivering our 10th million meal, which is crazy. You know, that's a lot of meals. And so we rely on volunteers. So if you're looking to get out and, you know, volunteer, we'd be more than happy to welcome your hours. You know, we have volunteers that, you know, come in for an hour, 2 hour. And like I tell folks, you know, if you love it, come back. If you don't, we thank you, because I know everyone's so busy. And so, you know, we do rely on volunteers. They are the ones that are in our kitchen, chopping, scooping, doing all the fun stuff, and have a great time. And also are the ones that are delivering these meals straight to a client's door. And so, you know, I've done a couple of deliveries, and, you know, it's amazing to see the impact and the appreciation that folks have for us when we make that delivery to their door, because, you know, these meals are so important. A lot of people rely on our meals. And so you're probably asking, you know, and I could, again, answer more questions during Q&A, but as far as eligibility, we cover these core illnesses, folks that have HIV, AIDS, cancer, ALS, MS, ESRD, chronic heart failure, and COPD. But with COVID, we've expanded these, and so we're making exceptions more and more to a variety of folks with critical illnesses. And the great part is we're not income based. So oftentimes people ask me, do I make too much money or I don't make enough money? We don't ask for income. We simply ask for diagnoses, and oftentimes, when you reach out to us, our client service representative team will work with you or a social worker or a caretaker to confirm what diagnoses you have. So again, we don't ask for income. I know oftentimes people feel like, that's a barrier, but for us, that's not a barrier. So as far as delivery, I know that was mentioned. We do deliver straight to client stores. For now, we're within the 694, 494 loop. So if you look at a map of the metro area, that's where we deliver mostly. We do have satellite locations where we'll drop off, and folks that maybe live outside the area can come and pick up their meals there. So if you want more specific details, feel free to reach out to me, to our team, and I'd be happy to answer those specific questions. And then we get a couple of questions for statewide. Do we deliver statewide? I know for some clients, depending on which program they're enrolled in, I know our HIV/AIDS Ryan White program, we do deliver for those clients out of state too. So again, if you want more information on where your client lives or you yourself, just reach out to us. I'd be more than happy to answer that. We'll put you in touch with the right folks to answer that question. So I think that's all I have. So I'd be happy to answer more questions in the Q&A. So thank you for your time.
Thanks for joining us, to all of our presenters. So we'll put options on your screen where you can go into whichever breakout room you want to ask the presenters more questions. And then from there, we'll call it a meeting. Thanks for joining us, everyone. I hope it was informative. And I'll send everything out also by way of email. So if you look at your bottom of your screen, it should say join a breakout room. And then you can click on which one you want to join, and it'll just take you right in there. Is anyone not seeing those squares at the bottom of their screen? Michelle, I see a raised hand. Is that from an old question? Or are you not able to get in the breakout room? I think that if you want to put in the chat which room you want to go into and you're not able to get in there, we might be able to just send you there. 1 second.
How how does that compare with your regular food shelf, your today's harvest? Do people come, do they just, can they come anytime they want to the regular food shelf, or is it once a month or every 2 weeks? How do you do that?
Yeah, so our drive up traditional food shelf is people can come once a week. And so that's been true throughout the pandemic. Pre-pandemic, people would shop for once a month. And then we had, other programs that they could use more frequently, but the food shelf was once a month. Then when we switched during COVID to the drive up, it's been once a week. And then, some people only use our drive up. And some people only use our today's harvest markets. And then some people use both.
Is that, do they pick out the food in the drive up, or is that a pre-packed?
A little bit of both. So there's, a pre-packed just bag of produce, and that's going to be the staples. So that's going to be mostly like potatoes, onions, apples, carrots, really staple produce, because we don't want to give out mangoes and avocados in the pre-packed when people can go and choose those inside the market.
Sure.
So they can get the staples there. And then we have various questions that we ask people about. Do you want milk? Do you want meat? And then we have racks of items that they can choose from in the drive up. So, we have maybe 6 different items, and we say you can choose 2 from the rack. So it's customized, but also some pre-pack.
Okay. So what about, are you doing anything with like dry goods, like say tuna fish and pastas and things like that? Plus other things, hygiene products, toilet paper, deodorant, those type of things?
Yeah. So in our drive up, we do the toilet paper, deodorant, that kind of stuff. And then in our drive up, we ask people, do you want an extra bag of dry goods, like cans? And half of people say no. But we do have that. And then in the market, in our today's harvest markets, we do have 1 rack of dry goods. That's what we always just say, is that's not our area of emphasis, because the today's harvest market is mostly about fresh food and food that we rescue from grocery stores. But we know we also rescue cans and boxes too, and so we make those available to folks. So you can find macaroni and cheese or flour or whatever there, but that's not really, the area of emphasis.
Okay. Thank you.
This is Barb from Hosanna's Pantry in Rochester. Can you tell us some of the basics about how you found your sites and where you get your funds from? And like all the refrigerated, the coolers, and how many volunteers does it take to staff this every day?
Yeah.
Where your volunteers come from?
So I'll answer the volunteer part first, because being open 33 hours a week at each market takes a lot of volunteers. And so it takes about 120 volunteers a week to run the today's harvest market. In addition to, on site, there's usually 1 or 2 staff people, and then the rest are volunteers. And so a lot of those volunteers were existing volunteers for the organization, but we're picking up a lot of new volunteers that are customers. So they come in and shop, they ask how they can volunteer, and then they have joined
of food and meat for both meats, produce, milk, cheese, etc. So we try to hit all of the nutrition needs in all of those areas. And so we started out, we had about 60 people, then it was like 60 families, then we had about 90. Yes, this past Saturday, we had 192 families.
Wow.
I
Do you
mean,
have-
it was such a big jump. We just emptied our freezer.
Yeah. But you have refrigerator and freezer?
Yes,
Okay.
but we just didn't
That sounds
have
great.
it for that amount of people, so they
I think we
cleaned
can
us
help
out.
you. We can help you.
Okay, thank you.
What else can I help you with?
Let's see. Well, if you can show us how to get more freezers, you know, we changed our whole electric so that the boxes just for those areas. We have
Uh-huh.
four refrigerators, and
Wow.
we have well, one that, because all of them were donated, so one of our freezers just collapsed. It was a 2-door, but I have one, and then I have small freezers, and so I have 1, 2, 3, 4, 5 of those.
Wow.
Smaller freezers, but I have, I think it's 3 refrigerators, the stainless steel ones.
We
So
tend
that's
not
our,
to pick up meat because we're not equipped to refrigerate it.
oh, that's
So
okay.
we generally, once in a while, somebody else call and want to donate a large amount of meat, but not very often. And
Mhm.
you know, we just don't, our volunteers are, it would be a safety issue for us to do.
Yeah,
That's why produce and bread work so well.
yeah, I understand that. That's why we have to have it delivered, because we don't have anything to pick up for meats and stuff.
Right.
Yeah.
How about anybody else?
I actually did want to just jump in really quick. And with just in response to the MCCC food shelf. So my name is Quentin and I'm the program specialist with FEN, which is the Foundation for Essential Needs. And so we do kind of the quickest way to explain that is that we are a nonprofit that does free consulting for food shelves. And so I'm going to put the email address that you can reach out to if you're interested in setting up a meeting with us. We can actually talk about ways that we can help with the cooler and freezer situation that you're talking about. That's one of the things that we help with, among other things like layout designs and food sourcing and then infrastructure sourcing as well. And so and I'm actually really excited you brought up Freedom Works. It's a food shelf that we've been working with recently. We actually just got helped Stephanie get a freezer and a new scale for their food shelf. And so they love the produce and then the food that they get from you guys. So I'm
Awesome.
really glad that you're able to
Stephanie's
help them.
amazing.
Yeah, they're doing some really cool stuff in a really they built up really fast, which is really fun to see. So
We just donated 180 pounds of chicken to them and they had a big barbecue in the parking lot. They're the ones that I referenced and the whole neighborhood came. They're such a cool organization.
Okay. Yeah, that
Betty-
would be great if he could help us with our layout for sure. You know, it's just a space right now and a couple of classrooms, so it's like I need help.
Betty, that's the perfect organization. I'm Ashley Hall. I'm from Falls Hunger up in Coochin County, and Finn has helped me since I took over as director. They helped us get freezers, fridges. We moved locations. They helped us with our layout. I just can't say enough good things about them. So I would highly, highly recommend connecting with Finn.
I will. We'll set up a meeting today.
Ashley, where are you located?
Up in Coochin County,
Okay. And how do you get your food?
Creatively.
Yeah, I bet.
We're part of Second Harvest North Central, but
Okay.
we are actually in the process of trying to expanding our retail rescue, our farm, our garden rescue. Our problem is our building or our facility is not big enough, so we're trying to relocate to a bigger one, which will allow us to store more food and hopefully rescue more food. But we are always open to ideas. I've even like reached out to like Cisco and some of the food deliveries, just trying to access more food, because that's a problem in rural Minnesota, is that we know the food is there, but by the time it gets to us, it's usually gone bad. So we're trying to come up with creative ways to get more food.
We're working with Dakota County and the city of Burnsville will be expanding south from us, and hopefully, continuing to expand because the need's so big. But our first expansion will be in Dakota County.
Okay. Well, if you ever want to expand north, reach out.
Okay. Love it. What else? Anything? What's the process like? No. Oh, I don't think this last chat was from me. No, that's old. Yeah, if you hear of other organizations that are in need of food, we're all about that. You can just use either one of those email addresses and let us know, and we'll do our best to provide food. As I said, we have a lot, I must say. And one of our challenges is we pick up a lot of food on Saturdays, as I said, and nobody's open, and we don't have the capacity. We don't have any facility. We don't have a warehouse or anything. So if we can't turn around and deliver it within an hour, then we can't pick it up and it's thrown away.
So what times are you picking up this food?
Anytime. I mean, we're pretty flexible. Like for example, like a couple of the co-ops we pick up on Saturday, and they, we can set the time as long as we can say, we'll be there Saturday at 10 in the morning. It's generally in the morning.
Okay.
We'll be there at 10 in the morning, and then we deliver to, somewhere. Like Saturday, I picked up from 2 different Mississippi markets in St. Paul. We don't have many food recipients located in St. Paul.
Right.
We're really interested in expanding in St. Paul because Mississippi Market is a St. Paul co-op, but we don't have anybody that will take the food in St. Paul in Ramsey County at this point. So we take it to an organization called CAN, Minnesota Community Alliance Network, and they got 580 pounds of produce on Saturday. So, we've got food. We just need, again, we need to have effective organizations to partner with to get the food to the people that need it.
Okay. Yeah, because our food shelf starts at 11.
Yeah, that'd be fine.
Okay. Cool.
Awesome. Anything else? Feel free to email me at executive director at TC Food Justice. Check out our website, TC Food Justice. And I'd love to expand what we do and partner with any of you.
Great.
We're always looking for kind of different, like the food group this morning was so excited. They're like, let's think of a different way to make an impact. I'm like, okay. Okay. So we just have to figure out how to make that work. We also do a bunch of gleaning right now. So, which means we go out into farmers' fields, a lot into orchards right now. And we, our volunteers harvest what would just have been left on the trees or on the ground. So we're big on apples right now.
Yeah.
Really big on apples.
I was looking at a show on Channel 4 last night, and they were talking about the apple tree in the orchard in Minnesota is one of the top ones.
Yeah.
And they look for a particular apple, and if it doesn't taste good, they don't even harvest it. They said tens and thousands of pounds of apples they just give away.
Yep. And so or they don't even harvest them.
Yeah, and they won't even grow that tree again. They get rid of the tree. I was like, oh my goodness, they must have a lot of space.
Right. Right. Okay, well, thank you for your time. If there's, I don't know if we're supposed to just end here or if we're supposed to go back into out of our chat room.
Yeah, nope. If you guys are done chatting, you're free to leave the meeting and have a great day. I don't think we have any sort of wrap up happening in the main room. So
Perfect.
Oh,
Well, I hope to hear from you.
you will hear from me.
Okay, Betty, send it to the executive director at Twin
Okay.
Cities Food Justice. That's me. That'll come right
Okay.
into my box and I'll take a look at it right away.
Thanks, Ann.
Okay, take care. Thanks all.
Okay.
Thanks for your
Bye-bye.
work. Bye.
numbers. And because when those that do give us our phone numbers, we're able to see how many new households we served that month. And then we're able to see, you know, how often we serve them. And, you know, and a lot of information for the folks that don't share their phone numbers. We have to, like we leave those out of the unique visitors, like the new unique visitors every month, because we simply don't know. And then other times, you know, we apply the same percentages to that. So it depends on which report we're talking about, but thankfully most of the people do share their phone number, so then that's how we're able to do that. But Second Harvest, I assume it's the same statewide, only asks the number of children, adults, seniors, and households for that.
And how many paid employees do you have then?
Yeah, so our whole organization has 14 paid employees, some of whom are very, very part-time. But the markets, like our smaller market has one full-time person and then 2 part-time people that work there. And then our larger market has one full-time person and then, you know, 3 or 4 different part-time people. It's a little hard to say because with the other market, because it's part of the larger organization and people are pulled in to help with that. But it's most of the time there's, you know, 2/3 of the people in the space are volunteers and 1/3 are staff. So it's a very volunteer heavy model.
And the drive up is also not TFAP, you're saying, right?
The drive up is TFAP.
Oh, okay.
Yeah, so that so if somebody drives up, we do ask their addresses, income questions, those. So for people who utilize our Today's Harvest market and they seem to need more food, and then we really encourage them to use the drive up. And then some people are able to do that and willing to do that. Other people that might have more concerns about their data or stigma, just use Today's Harvest.
What are the main jobs that your volunteers do?
Yes, so they sort through the food rescue as it comes in. There's always some food that needs to get tossed when it comes in from the grocery stores. So some of it, some volunteers are sorting the food. We need restockers throughout the day. So a lot of volunteers are simply keeping the shelves and coolers stocked throughout the whole time we're open. And then other volunteers are greeting people, helping with the iPads if there are any questions, just providing general assistance inside the market. And we do have some volunteers that pick up food from the grocery stores, but most of the time that we're doing that via staff.
How much waste do you have?
Yeah, we've calculated about 10% of what comes in, 10 to 15, but it's usually closer to 10 when we do it. We have to throw it, and we compost. So we have a company that comes and picks up our compost once a week. But about 10% of the food has to be composted.
Okay, thanks.
Mm-hmm. All right, well, I'll just give my email address. If anybody has any questions, you're welcome to email me at jessica@opencupboard.org. And I'm happy to answer any questions about Today's Harvest or anything else.
Thank you so much.
Yeah, no problem.
Is it .org or .com?
.org.
Okay. I probably have your old email address from Hunger Solutions.
Yeah, I might be in there still from Hunger Solutions. That's right.
Thank you so much. It's good to see you, and awesome job.
Thank you. Thanks so much, Diane. It's nice to see you too.
Thank you.
Thank you.
Thank
Bye.
you, Jessica.
Thanks.
Bye-bye.
Bye.